Good afternoon, everyone. My name is Kechi Ijoma. I'm an interventional cardiology fellow at Mayo Clinic. I have here with me Dr. Pat O'Gara, who is the immediate past president of the American College of Cardiology. Good afternoon, sir.
Thanks very much, Kechi, for having me.
Well, thanks for coming, sir. Well, over the past 2 years, maintenance of certification has been a hot topic for cardiologists and indeed for everyone that practices medicine across the nation. Can you talk about your role as the liaison person between the American College of Cardiology and the ABIM regarding resolving the MOC question?
Well, as you say, maintenance of certification has really become a hot button issue across the United States, not only for cardiologists, but also for other specialists under the umbrella of the American Board of Internal Medicine. And the ACC Board of Trustees in August made several decisions on the basis of which we will go forward with continuing a conversation with the ABIM in the hopes of improving the process further. I think there have been a lot of positive developments over the last 15 months with respect to the ABIM maintenance of certification process from the point of view of such things as eliminating double jeopardy and freezing the fees that are associated with taking the examination. But it is our hope with continued liaisons with the ABIM to influence the processes ahead with respect to further modifications to such things as the secure examination. And I think for most practicing cardiologists, the 10-year secure examination is still the most hot-button issue of several. Issues related to practice improvement and patient safety and patient surveys, for example, although currently there is a moratorium regarding their further development, it is widely anticipated that they will be back because these are also elements by which reimbursements will be directed to us as cardiologists and to our institutions. But I think it's important for us in the American College of Cardiology to recognize that we are all interested in maintaining the principles of lifelong learning, that professionalism and attention to being able to meet the expectations of our patients and the public, these are of highest concern to us, and we do not wish to abandon those principles and those ambitions while we attempt to just modify some of the more granular and logistical aspects of the process.
Well, thank you so much. So more to come on the MOC question in the future.
Very much more to come. Yeah.
Talk about advocacy, sir. I know you've been coming to legislative conference for several years. Can you talk about why this is important to you and why it's important to FITs?
Well, thanks. That's a terrific question, Kechi, and it's great to see that we have so many fellows in training here at this year's legislative conference. I think that the ACC recently has gone through a process of trying to strategize around issues to advocate regarding research and innovation in the United States. And for those of us who are products of academic medical centers like you and like myself, there is a high priority to be placed on funding for NIH research. Certainly funding is the means by which research is supported, new knowledge is brought, and new careers are hatched. And I'm very passionate around making sure that there is enough support and enough funding for the next generation of physician scientists and clinician educators going forward. So funding for NIH research is a top priority, and we can be here in Washington to advocate for that. I think we also have to advocate for support of graduate medical education out of fear, for example, that Medicare reconciliations might take money away from our ability to train the next generation of residents and cardiovascular fellows. And I think without this, we're at risk of losing our place as leaders in the field of biomedical research worldwide. And it is extremely important to hammer these issues home as often as we can.
Well, thank you so much, sir. You are well admired by lots of FITs. You are a well respected clinician educator, and we thank you so much for coming and for talking with us today.
It's a pleasure. Thanks for having me again. Thank you.
Well, thank you. You can watch more videos like this at YouTube, Fits on the Go blog. Thank you.